foreign material that we know. Death was ruled accidental. I want to talk about that. Accidental. What does that mean, accidental, right? Because you're wondering, well, how can that be accidental? Extremely rare. Let's talk about the percentages real quick. There's about 1 million injections to 2 million injections done in the USA per year. And it's about 1 in a million is roughly the number. What is the percentage chance that you die in a car accident if you're a driver over your lifetime? This is a real shocker. I was told this 15 years ago. I didn't believe it, but it's about 1 in 100. I looked it up today. It's about 1 in 93. So that happens. And we have to understand, the older you get as a doctor, so when you hit my age and stage, what you realize is we do less. So you go to see an older doctor like me, the less interventional we want to be because we've seen bad things. And as you get older, you get softer and you don't like to see bad things. So that's roughly what happens. So let's move to the next slide and move through here. So a lot of people want to know this. Do we know this? Okay, which filler was used? I think that's the number one question. And you have to know that there's hyaluronic acid fillers, which are dissolvable. Those are the most common used. I talked about collagen when I first started my career. And though collagen filler was not dissolvable, but we didn't know that these things could occur. We didn't know occlusions could occur. We didn't know all those things. And so ignorance is kind of bliss. Now we know a lot more. And I'm going to go through some of the side effects that you don't even probably know that can happen, that we don't know are happening all along. And again, this isn't to fear or to create fear. It's to create reality for people. Where was it injected? Now, this is a huge one. Where was it injected? So I'm going to show you some pictures of the face, but the number one areas where we're going to get a problem, the buttocks, the penis, the vagina, those all are large vessels that lead back venously, I'm going to show you that, to the lung. It's the venous system, not the arterial system. That's a totally different thing. Who performed the treatment? We don't know. That's something we don't know. That does not come out in a coroner's report. How much product was injected? I want to talk in detail about that because that makes a big difference. We don't know how much, but I'm going to show you something. Needle or cannula, we need to talk about that because a lot of people still haven't adopted cannulas, which I'm going to show you what that is. They're blunt tipped. The exact timing, this is a very interesting part. What's the timing between injection and collapse? Well, we know the procedure was done. We know the person went home, took a shower, started having problems, and he died in the arms of his husband was reported. That's what we know. But assuming that this was done in a clinic somewhere, that there's a time lag there. So a lot of times this is an incident. And what do we know from this? Deaths from fat transfer, from buttock injections, BBLs, Brazilian butt lifts, they occur over time. So typically they can occur 8 hours later, 10 hours later, 6 hours later. They can also occur in the recovery room. So there's sometimes a time lag. And so are there warning signs that were missed? In this case, we don't know, but sometimes there are warning signs. Okay, so a lot of people wonder, what's a pulmonary embolus real quick for those people? So here's your venous system, and red is your artery system. And why the penis can be involved and the buttocks can be involved and the vagina can be involved is because there's a lot of blood flow to those areas. And the gluteal muscles are big. They need a lot of blood for you to walk and run. And then the other, obviously there's a lot of vascularity to the other two areas I mentioned. But when, and this gets confusing, I know we have a few hundred people on here. I don't want to go too much into it, but the venous system is your low pressure system of the body. It's going to make a big difference in a moment, except in the heart. So your pulmonary vein is actually a stiff pumping. The heart pumps through the pulmonary vein to the lung. So your pulmonary vein, the vein usually will not be strong, but the pulmonary vein is, because it has to get things to the lung. And so that is your venous blood coming back. And this is the problem. You get a death of a piece of the lung, and then you get what we call a VQ mismatch, a ventilation perfusion mismatch. And you go into a lot of things. You get hypoxia, so you get low oxygen. You get a cascade of events that mismatches the oxygen to the arterial supply to the body. So a lot of things happen that are complex, but it's one of the big 8 causes of death. Let's put it that way. But it's quite complex. But now you see how it goes from the veins, and you'll know DVT, a deep venous thrombosis or a blood clot in the vein of the leg. People know this, does the same thing. So understand that. This is be important because we're going to talk about arterial occlusion on the face, which is something totally different. So let's move from this, and you might have questions on this. Let's see, I can monitor the chat here. Okay, yeah, blood circulation problems, but I am going to take questions at the end. But let's go on, and then I'll come back to you. So what do we know? The reason that one of the reasons this is because there are other deaths. I'm going to tell you about a few here coming up. But one of the reasons this has so much attention is because it was an executive who was in the aesthetic world, okay, and highly influential. And you can see this person was in the industry for a while. Arami is a fragrance company. Bobbi Brown, you guys think that's more makeup. You guys know all that. L'Oreal and Kiehl's. And then he went to other companies. But as of 2026, and the death occurred in February 2026, obviously he's a leader in Estee Lauder. Okay, so that made the case a little higher profile. Okay, now this is important because there are common things and there are uncommon things. I said it's about 1 in a million to get a death from a filler, and we'll talk about the face, but it's 1 in 5,000, 1 in 10,000 risk to get an arterial occlusion, okay? So I'm reading in here some of your comments, and I think I see a really good question. I'm curious why ultrasound similar techniques. So you can ultrasound the face. This person is asking why people don't regularly ultrasound the face. It doesn't work. There's no proof that works. You can see the bigger arteries in the face, but it doesn't mean you see the small ones. And you can, if you're doing temporal injections, you're looking for the large temporal vein, or artery, you could find it maybe. But it doesn't mean you're going to see it in everyone. And it would take you an hour to do injections. People are in and out in 15 minutes. Also, it doesn't prove that you're not going to get this problem because you can't see all of them. And we believe some of the smaller ones that you can't see on ultrasound are still culprits. And remember, there's 3 reasons why you can die from filler. One is the blockage. I showed you pulmonary embolism. The second is a cerebral. So in the arterial flow of blood, it can go to the brain, and there are cases of that. There's a good 6 or 7 cases where you get a clot that goes to the brain. Think of a stroke, okay? Think of that. And that's the arterial system. And the third way, these are 3 common. So venous into the lung, 2 is arterial into the brain, 3 would be anaphylaxis, meaning you have an allergic reaction to the product, okay? Those are the top 3. Okay, now this is going to be important for you to understand, and the ultrasound question is good. I think we get into that later. I like that. Here is your artery. Do you see how thick the wall is? Here's the vein. You see how thin it is? Well, I'm going to show you in a minute what cannulas are. Cannulas, typically the idea is it's a blunt. It's not a needle. It's blunt. See if I can change my color here for a minute. It's blunt, and it comes in. It's got an opening, a port that's distal or proximal to the tip. So that the idea is when you come in with a cannula, it will bounce off the hard artery. When you talk about the venous system, it's much more likely to puncture through a vein. And I think we puncture veins all the time in the face. We're just not in big enough vessels to cause a problem. And veins have many veins that are collateral flow. So if you block one vein, there's a lot of veins that take up the other areas. I'm going to show you something in a minute. So it's not a big deal typically to block a vein in the face. You might have more swelling than normal. You might not know what's happening, but it is a problem when that travels to the right side of the heart. Okay, So there's a difference between a vein and an artery. We can come back to the Q&A to answer more on this. I just don't want to get too complicated for those that don't want to go through it. But here's the thing. This is a 1 in 5,000 or 10,000 problem that you probably do need to be concerned about. Arterial occlusion. We're coming back to the death and historical death cases, but I want to take you through what's common being common. Let's go back to yellow. Common being common, arterial occlusion, and that's where blindness comes in. Talk about that in a second. But arterial occlusion, 1 in 5,000, 1 in 10,000. Blindness, 1 in 100,000 is an accepted number. Now, when you block an artery, you get an ischemic area. That means a death of tissue. This is not anatomically correct, by the way. The artery comes up on this is the facial artery, by the way. This is supposed to be the facial artery. It comes up on the bone and then gets superficial, travels up to be your angular artery, and then goes up into your supratrochlear area. And then it goes off inferior labial, superior labial arteries, and an inferior one that comes to the chin. Chin fillers are common now. We see more occlusions. But keep in mind, so this isn't anatomically correct, but keep in mind what happens if you block the arteries, there's no oxygenated blood flow down here, and you get this death of tissue on the face. I'm going to show you a picture of what that looks like because it's important to know. And that can occur immediately. There can be signs, or it can occur 10, 12 hours later. It can be from product. This here gets complicated. There can be from product going into the vessel, which some people believe that's the only way. I happen to believe after 25 years of doing this and using so many different fillers, some cause more spasm, that you get spasm of the artery, because you can clamp the facial artery in surgery and you don't see what you see with filler, right? You can clamp it. But you get spasm of the whole arterial complex from fillers. It's what I believe happens, at least partly. Of course, you could block it. But so you see, we don't know everything. We don't know hardly anything in medicine, you know that. So you get that. So that's arterial occlusion versus venous embolism. Remember, venous goes to the lung. This causes downstream oxygen problems. Two totally different things. But the arterial system can go obviously to the brain because there's communicating arteries. Okay, you get retrograde flow. I'm going to show you a slide where that's important. You see the stuff I study and geek out on all the time now. You know where I spend my days. Okay, let's talk about this. Let me look at the chat, make sure everything's going good. Okay, great. Okay, does the same apply for biostimulators? That's a good question. So I have fillers in my face. For the past 5, 6, 7 years, maybe a couple vials of filler, but I move over to biostimulators. Biostimulators, it depends which one. There's so many. If you take something like Sculptra, it's a tiny molecule. You're looking at 50 microns in size, 60 microns in size. So if you take your pen and you drop it on a piece of paper and you see that little pen piece on the paper, just a fleck, the Sculptra molecule is tinier than that. So it's way less common. I'll go into some more details in a minute, but has this happened before? What about death? I'm going to tell you right now, because I've done this 25 years. I get Google alerts when things happen. I read all these cases that I can get my hands on. There's a lot of cases that happen in cars. So an injector will come, inject someone in a car, at their home, at other people's homes that aren't reported. Okay, so this happens, it's not reported. Why? Because typically, a lot of times when people have this happen, they either are doing it to themselves. There's a lot of cases of that. They're looking for low price. They're looking, obviously we all want low price, right? But sadly for the people looking for low price, they're not getting hyaluronic acid filler. They're getting silicone and they don't even know it. And that's not dissolvable. The body can't metabolize that in any way. And that's an immediate death, pulmonary embolus, stroke, whatever. And you're done, meaning there's no way to revert. You can't even, when you put silicone in a face or a lip, many people used to put it in lips, you have to get surgery to remove that. It's pretty much, you can't remove it all. It's just a stickly, ickly mess in the tissues, in the connective tissues. So think about getting that into the lung. So there are cases from the nose, here's cerebral infarction. That's the head we talked about. The temple is, I was just involved with a company that just got approval of a temple indication of 2 different techniques for filler. So we just revisited everything and all the data and what techniques we're going to use for temple injections. Because what happens? I've been doing temples for over 20 years with different products. But when we release it to the world and we say, now here's your filler, here's the FDA approved, that means every med spa in the world is going to, it goes on to all the press releases. Everyone gets alerted. Vogue does articles. New Beauty does articles because the company wants notoriety. It takes a lot of work to get that FDA approved. What happens? All the injectors in the world go, I want to do temples. Now you've gone from, I'm just throwing out numbers, 2,000 people like me injecting temples for 20 years to 40,000, which is about the number of injectors in America. So about 30,000 of them all of a sudden start injecting temples. And that's where the scary part comes in. Now, bad things can happen when I inject a person. Bad things can happen when brand new people inject a person. But the chance of a new person, maybe doesn't study anatomy, not aware of this, like I wasn't aware in 2003 because the industry wasn't even aware. That's a higher risk for people. So understand that. But I know very seasoned dermatologists, plastic surgeons, aesthetic injectors who have had bad complications. It can happen to anyone. But here you go here, vaginal wall, gluteal region, by far, this is the number one, okay? So enough on that. I think we can ask questions if you have other questions on that, but let's go to the next slide. I want you to see this because for me, I'm asking my injector always to use a blunt cannula. Why? Because let's say it goes through an artery a little bit. I think you guys can see the drawing there, right? The opening where the filler is going to extrude, let me turn to red here. The opening where the filler is going to extrude is proximal. Here's the syringe. Here's where the product's coming from here. See how that writes on there? Okay, great. The product is coming proximal. It's not at the tip where maybe you're in the artery. Plus it's blunt. So the idea is it should bounce off, right? Well, it's not that simple. Nothing's that simple, you guys, right? Check this out. So I was involved in 2009 when cannulas started coming to America. 2008, 7, okay, it was all around the world. 2009, people here started talking about them. So 2008, 2009, I'm like, what is this? So we studied cannulas, okay, right? There are small ones like this, and there are large ones like this. Larger ones, the larger is probably the safest. The smaller, why? Comment in the comments, do you know why the smaller might be more dangerous than the bigger one? Comment in the comments to see whether you guys know, have an idea, because sometimes your idea will be better than mine. I can tell you what studies show, what we see in vivo, in vitro, and in models. Okay, so easier to perforate the artery. Gosh, we got smart people. You hopefully you're smart because you're following the channel, but it's part of it and I'm helping you, but you're smart. Absolutely. So if we remove this and I go this, and this is a representation, but a 30 gauge needle will hurt. A 30 gauge cannula, if you put it onto your skin, it's going to hurt you. It feels sharp. It can poke right through the artery. Let's go to yellow here. Okay, it'll poke right through the artery. And if you get a larger one, it's more likely to bounce off. Now, people want to go smaller because that means you need a smaller opening in the face. For those that don't know how these work, you just put a needle in the skin first. Let's go to pearl. We'll see if we get this color. You put a needle, a sharp needle in first. How do I draw a needle, you guys? There you go. Let's draw that. My artistry is probably terrible. But you get a sharp needle, you put it in, you create the opening, and then the blunt cannula that will then go into the skin. Pretend that was the skin. So that's the idea. You make an opening with the needle. Needle's never going to hurt you. If you go into an artery vein, you just put pressure. When you cut yourself, you're into an artery. Sometimes you're in a vein, lots of times why you bleed. So just putting a needle in without filler, not a problem. And then you put the blunt cannula in. I should have explained that earlier for those that don't know. Listening from Dubai, hello, good to see you. Arizona, wonderful. Yeah, so, okay, so you see how complex this all is. So my point to you guys is there's no study. It's like your peptides that you're all taking. There's no study on this to tell you exactly what to do. So you rely on people like me, people in the industry who study it, people who've done this for over 25 years, the companies that do trials, collectively, people with your best interest in mind that put it together. Okay, so let's go on. We'll get to the Q&A. I'm excited to see and answer some of your guys' questions. But I just saw a comment down here. Oh, by the way, here it is. I live in the UK. You can do a 2-day course and get insured and start injecting people. There were just, from the UK, you tell me, there were just 2 deaths in the last 18 months from filler. And this is, I read this, this may not be 100% factual, but I read it online from a doctor, posted it, reliable source. They were both gluteal injections. They were both put in the buttocks with filler. And I'm going to show you something shocking in a minute here about what filler. So in the UK, you got a great point. Anyone can inject. Go down to Harley Street, user-NS 5kg. Have you been to Harley Street? I've been to Harley Street. It's been a while, but that's where I see all these clinics when I'm in London. Okay, so we talked about this, and someone just in the comments, let's go to yellow here for a minute, said, hey, I'm scared of getting my temple injected. Yeah, there's a large vein in the temple. There's 2 arteries, superficial temporal artery, deep temporal artery. That would be one worth ultrasounding for. For those that are super paranoid, you could ultrasound them and typically see them, but anatomically, they're quite predictable. So we can know where to inject 99.999% of the time. And then you take the fact that it's 1 in a million and you're down to a good number. But yes, the vein goes to the jugular, superior vena cava in the right heart. So it could happen that you get a pulmonary embolus. In the buttock, this is the most common one. So this is what you're going to see. Or the penis, the vagina, we just don't see that many injections. Penile are increasing. Buttock, the whole butt lift thing has seemed to me, you comment below, has decreased. I don't see as many people wanting that look. We're into the thin look. The reason is we have GLP-1s, retatrutide, which is the newest one, will be FDA approved soon. We have Mounjaro, tirzepatide. Okay, you know what I'm talking about. Ozempic. Because of that, now the people can get smaller. All the influencers are like, oh yeah, I'm small. And that's the trend now. So we don't see as much buttock in high volumes as we used to, in my opinion, but you guys tell me. But in the buttock, how would it get up? Well, you can see you inject in the pudendal arteries and veins are deeper, but they're large, and it goes up to the heart, the right heart, and then into the lung, and there you go, boom. So that's the method for those that want to know how it happens. Maybe that's too much. You guys don't want to know that stuff. But this, remember I said 1 in 5,000, 1 in 10,000? This is what we're talking about for arterial occlusion. This is the common thing that you want to worry about. And part of why it's worrisome, and I can tell you, I had a patient 15 years ago where the number one sign they're going to have is pain. And I did some lip filler for her, and she had what you see here, down here. And she swore she didn't even, so this happened a day, 2 after I inject her. I got a little more pain than normal. It often looks like a bruise, and that's where people miss it. Oh, is it a bruise or not? Because it'll look like this, and it's an early sign. It'll look like this. People are like, oh, it's a bruise. But then you see this necrotic tissue come out. But here's the problem. People, and my patient who had it on the lip, I've had probably 4, I don't know how many injections I've done in my life, but tens of thousands. Near 100,000, 200,000, I don't know, 25 years of doing this day in, day out, you do the math. But hers was on the lip, and she thought it was herpes. And the reason is her friend had something that looked similar, got on a cyclovir, it went away. She said, oh, I had herpes. She goes, it was just it. I go, no, that's an occlusion. I put Hylenex in. She's like, oh, the pain goes away. To this day, she thinks it wasn't the filler, it was herpes. I tell you can only convince people so much. The fact is it got better. Funny enough, for you people wondering, this will usually end up with no sequelae. Whether you dissolve it or not, this looks terrible. The face is amazing at healing. Why doesn't it get infected all the time? The blood flow to the face is amazing. That's why we see infections not that common. A lot of blood flow. But this funny enough, it heals up quite well. You see them look. Why it doesn't is if you get a complete blockage, if you don't reverse it in time, maybe. Darker skin, My color and above, of course, we tend to get brown spots, more sun, more pigmentation. But most of the time it heals up fine, but it can take months. I don't know if you have more questions on that, but remember I told you, by the way, I'll tell you what happened here. Your facial artery comes up, it's on the bone right down here. And then it comes up and you get your inferior labial artery, your superior labial artery. The one I nicked on this girl was just the columellar artery here. Okay, there's a little artery there, a tiny one. That's why it wasn't a big problem. But boy, real doctors, like real people like me, were scared to death. If your doctor's not scared, if your provider's not scared, go get another one. I'm scared every day, and you should be scared. That's what you're looking for. And then your facial artery comes up here, but then this turns into your angular, okay? And that's the one you really got to watch for, because that one, there's arterial venous anastomosis, they connect, but that one is a risk of blindness, as well as the temporal, superficial temporal artery. And the scariest part, I don't have a forehead to show you, but the left side communicates with the right in the forehead. So theoretically, I've never heard of a case like this, but you could go blind in both eyes at the same time. This is the stuff we talk about in closed doors. Okay, if you want to know, that we fear. Okay, this is one of the last slides. And let me know in the comments, is this too much for you, or is this the stuff that you like? I have no clue. I'm just winging what comes into my mind, and so and then we'll talk about prevention at the end in the Q&A. But is the most important part of this when you're talking about potential death. As you know, I just got back from Korea. I have videos on my phone so I can show you the large vials. Typically, you see it in Korea, Japan, Thailand, Singapore, all over Europe, the Eastern Europe. You'll see here syringes that are 50 mLs. This is 1 ml syringe, and that's what you're going to see in the USA. This here, you're going to spend like, say, $800 for this in this country. Overseas, you might spend $200 for 50 times the amount of product. Imagine if I went overseas, I bought this vial here. Let me get you another color. Imagine if I bought this vial here, brought my 50 mLs back, put it into 1 cc syringes, and for $200, and now I have my cost per ml is nothing, okay, like $4, and I can inject that and make $800. Do you see what I just did there? So, and in a global world now, you can order this online. You don't even have to go to Korea. And now let's just say that I went and I got silicone here, and that cost me $1 for 50 mLs. If I really wanted to make it even more money. And now it costs me like 1 cent to put that in the 1 cc syringe. You come in, you say, hey, I want a vial of hyaluronic acid filler. And I give you, oh yeah, no problem. And I paid $1 for it, and I charge you $800. And let's just say that I was social media guru. Everyone wanted to come see me because everyone knew me. And I go, well, I'm only going to do things for $2,000. Let's say I get it for 1 cent. Well, I got cash, right? And it's a disaster. Silicone is a disaster. This filler might be okay. And the reason I'm showing you the filler, I got off on a tangent there to show you when you go for cheap stuff, or if you don't know who you're going to see, that's the problem. But the problem here becomes when you put this amount, that goes in the buttock. People put that in the lower sections of the body. Then that amount to the lung is devastating. Not this amount. You're starting to get into 1 in 4 million, 1 in 5 million problem here. You're probably down to the 1 in 100,000, 1 in 50,000 problem when you're doing, because 50 mLs in a buttock is nothing. What do you know? Your skincare cream jar is about 50 mLs. So if you empty this out into your skincare jar, that's 50 mLs. Here, plasma restore volume So where's my camera here? So this here, this cream that I have, that's 50 mLs, and that, that's not that much. Okay, so if I'm putting that into the buttock, and this is a wide wall of plastic, not plastic, but similar. I'm putting that in the buttock. I might put 3 of these per side. And then you got the hip dip. So you might, of these 50 ml syringes, you might get 7 or 8 or 10. And then you look at it and guess what happens to the human? The human goes, Rajani, that looks good. Give me 5 more. And now what happened is you got a bunch of blood flow going to the buttocks because you just injected 5 of them. And I go get a coffee and I prep you and get you ready. I come back and do another 5. That second 5 is the dangerous 5 because the body said, get in there. There's trauma. There's something bad happening. Send blood flow. That's what we do. And now your blood vessels, instead of starting off and being this big, are this big. Obviously, I'm not to scale there. Do you see where all this goes? So that hopefully gives you an idea on that. So last slide here, I want to show you, this is what we know. It was determined to be accidental. And again, condolences. I have trouble even speaking about this because this is so rare and this is optional. If you were going in and you needed quadruple bypass surgery, it's way more predictable now than it was 20 years ago. But if something happened, you passed away, well, you had your risk of passing away from having 4 arteries blocked in your heart is very, very high. So that surgery was probably needed. This surgery, this wasn't probably needed. It was desired. And we're always playing on that balance, aren't we, with life? And there's a risk to not doing anything. We know that people that look better, look more refreshed, they make more money, they get more jobs, they have more opportunities. Their social life is better for what they want. If they want to be an influencer, all those things, they're going to get stuff done. It's a lot of pressure. But what does accidental mean? And then we'll talk more. It means the death was unintentional. And that's important because it does not mean there was no negligence. Does not mean that. What it means is it's not a homicide, a suicide. It's not natural, and it's not undetermined. We know it was a pulmonary embolus. We know it was a foreign body. 1 and 1 equals 2. It was filler. We don't know what that filler was. I just went through a lot of fillers with you. There's a lot more different fillers than I talked about, but any of them I talked about could do it. Sculptor, very unlikely to do that. It's just such a small molecule, but is it possible? Of course it is. It also doesn't mean the procedure was safe. Just because it was accidental has nothing to do with safety. And it doesn't mean that whoever did it is out of the woods for any legal issue. So acute respiratory failure, pulmonary embolus, foreign material, that's what we know. So what I want to do now is kind of come back to you and let's see if we can come back and just answer a few questions here. Let's come back. Boom. And there we are. There I am. You should see me back in, everything should be normal now. Okay. Now, here we are. So what we went through. So someone says, I hope he answers it. I'll answer anything you ask me. Can you ask me again? By the way, I'm alone here. So it's just you and I. We have no moderators in the chat. Everyone's working elsewhere. I went to so first of all, let's redo your chat. So ask your questions. I do want to answer them because I think this is so important. Again, if you're just joining us, I'm Dr. Rajani. Been doing this over 25 years, injecting product. And there's a lot of fear over the recent filler death. My goal is to answer questions around it and understand this is very, very rare. But if you missed the presentation, come back. So watch it so you get an idea. So can this happen with Botox in the frown lines too? So Botox, there is a case of blindness. There's a few cases of blindness with Botox, but Botox is a small molecule size. How did that happen with Botox blindness? You're going to say it's not common. Of course it's not common. The reason it happened was because when you put any needle in the face, and there's cases of corticosteroid injections, I don't know if it was for acne, but you'll know it because we put steroids sometimes to help decrease inflammation, get your acne better quicker. If you got a wedding or something going on, there's cases of blindness from that because there's a skin tag. The needle's hollow, so it dislodges a skin tag. That skin tag, if it goes through an artery, it can go to the eye or to the brain or elsewhere. Again, a little skin tag going to the lung, probably you'd never know it, wouldn't do anything. Okay, there's something that we measure called a D-dimer. By the way, how do you know you have a pulmonary embolus? In the blood, we can do blood work. We check for something called a D-dimer if you're low risk. Old school, way back in the day, I used to do a VQ scans, was how we did it, a ventilation perfusion scan. Now you use CTAs, CT angiography. Very, very good at detecting these. But again, death can be sudden, so you don't know. So can this happen with Botox? So I answered that. Keep asking your question. Thank you for your lives. You're so great about sharing knowledge. Yeah, my goal, hey, I have all this knowledge in my head. I've done this forever. I'm happy to answer questions. If I don't know something, I tell you I don't know it, but I know a lot only because I've been doing this for a while. I got collagen yesterday injected under my eyes using cannula, having some anxiety here. You got collagen because you didn't get collagen. We don't have that in this country anymore. I don't know what country you're from, Lopez. You can tell me. But people who, if you've had an injection before, this is interesting. But per Cal, you'd have to tell me what you had injected because in this country, you can't even get the collagen. I would like to get the collagen because it was the best product at the Vermilion border. When collagen and Restylane existed, 2004, I used to put hyaluronic acid in the lip. And at the Vermilion, so where the white meets the pink of the lip, there I would put the Cosmoderm and Cosmoplast, and that was the best looking lips we ever made. We don't have collagen anymore because it was soft. Do we know the person had pre-existing vascular problems? All we know it was the person was prior healthy. Can this also be an issue using Radius? Of course. So Radius, for those that don't know, is calcium hydroxylapatite. Again, it's a small molecule size, but here's the thing, 30% of the syringe of Radius is calcium hydroxylapatite. So that's your calcium, that's hard. That's why it's the stiffest filler. Calcium's a particle size. If you then take the 70% of the syringe, it's something called carboxymethylcellulose. That's a product, it's a carrier. It's in your shampoos, it's in some creams. It's not in any of mine, but you'll see it in skin creams, makeups and stuff. That has a particle size too. So blindness could occur from it, absolutely. Arterial occlusion, definitely. The problem, I love Radius. By the way, nothing here is sponsored. I'm paid by no one. I'm just here to give you information for this video. But I like Radius. Hyaluronic, Radius does not, I don't see the spasm of Radius. It's more neutral that I see the spasm more with hyaluronic acid. But there's always this is why doctors calculate stuff. It's why people injecting peptides at home and doing all this stuff gets a little scary because you got to think of what I'm calculating. I'm calculating that if I put Radius into you, it's less reactive, but I can never dissolve it. People that say there's a dissolver from Radius, we have tried just about everything to dissolve it. You cannot. So if you get an occlusion with Radius, it's supportive care. What does that mean? Warm compresses, massage, Viagra-style tablets to open up the arteries so you get more blood flow. You can use hyaluronic acid or hyaluronidase as a dispersant, but it's not going to dissolve it. So re-asking, does vascularity location change as you age due to volume loss, structural changes? No. But what does change is the stiffness of your vessels, but your vascularity location, sure, the face sags a little bit, but I'll tell you right now, the amount of anomalies in a face, I teach cadaver sessions, sometimes, rarely, but I do. They call me up to stage. So if I'm in a cadaver course, they're like, Dr. Ajani's here. Will you come up and describe this? And I'm like, oh boy. I'm not the number one anatomist in the world, but I know my face anatomy. But when you're teaching it, it's another level. There are some super smart people and anatomists in the world. And I'm not one of them, but I know my stuff. The anomaly, to answer your question, two faces are almost never the same. There's predictability of certain vessels. But even if you look at the facial artery coming up here, gives your inferior labial, superior labial, and then it goes up to form your angular artery to up and connects with your supratrochlear. That vascular system has so many anomalies for your superior and inferior labial artery to your mental artery. They're all over the place. So and that's why ultrasound doesn't help that much, to be frank. You can ultrasound the big vessels that are predictable, like I mentioned, but ultrasound in your face is not going to help prevent blindness to a great degree, and it's not been studied. There's no double-blind placebo-controlled trial where we ultrasounded faces and then we didn't, because how are you going to get a 1 in 100,000 event? You'd have to treat 2-3 million people. Just doesn't happen. So skin, that that answers that question. Is this also a problem? Okay. Is this also a problem when the back of the hands are filled? I've done a lot of hands, not in the thousands, but like 500-700 hands. I've never, the hands get a lot of swelling that people don't understand because it is looser tissue than you think. But the veins in the hands, I've never seen it. It would have to come up through the axilla to the lung. Again, the hand is low volume area. And the beauty of the hands is we can do it with cannula. And you can pull back on the plunger to see if you're in a vessel quite predictably, depending on the filler used. So I've never heard of a case in the hands. And again, sometimes you can't be concerned about where it's never happened before. How do you feel about microdroplet? Okay. How do you feel about microdroplet silicone? I had it in my lips in New York by Famous Derm twice, no issues. Great. If you're happy with it, great. It's ocular silicone, no problem. Silicone's pretty much silicone that's done. If you're happy, fine. The problem is you can never have it removed. It has to be surgically removed. It will never be removed. As you age, as long as you like it, a lot of times a 30-year-old wants a different lip than an 80-year-old. So that's to age with you. So I would never overdo it with that. But yeah, if you're happy with it, silicone in the body, it works well until it doesn't. If you all of a sudden get an autoimmune disorder or anything like that, the body will want to attack things. That's when the problem comes. So stay healthy. I would never overdo it with silicone. Silicone's not something I've ever injected into a body anywhere. It's nothing I would want in my body, but we make choices, right? I think this is good. Let's see. I think I'm good at my age. I'm just happy to wake up. I will do my skincare and will be okay with that since I'm diabetic. If you're diabetic, honestly, your risks go up for everything. You know this. And when you get older, so at my age, I get up, I'm pretty darn happy to use my skincare, use my home tools, and gua sha. That gives me my morning lift up. It removes my double chin. It sculpts my face, my lymphatic flow. And I go, oh, let's get on with my day. I'm with you. You're happy to wake up. And the other thing I'm happy is that my joints and my body feels okay so that I can do activities. I hear you. Collagen. Yeah, I'm not familiar with collagen. Geez, I could look that up real quick. No problem. Tell you all about it. The problem is you had it under your eyes, great, and you had it yesterday. The longer you've had it and it's fine, then no problem. Obviously, to go blind, a person needs to put in the vessel. That's an immediate thing. I've never seen that occur in a delayed fashion. And you're from Texas. Interesting. Collagen. Check on that. Check what it was. Interesting what you paid for. It's not an FDA approved product in this country. You have me so curious now. I wonder, I'm going to stop something. Let me look something up for you. This is interesting. If you're spelling it right, I know just about everything that's out there. So I'm intrigued by this. Yeah. I don't know which product. You have to spell it right. I've never heard of a collagen product. I can tell you there's nothing FDA approved in this country called collagen that I know of. So Percal, you'll have to let us know more. Could I be wrong? It's possible. It's unlikely on this, but we'll look. Okay, so let's see. I've not been to Harley Street. Okay, so for those, when you go to Harley Street. I've not been to Harley Street. That's in London, by the way. Literally all over the UK, beauticians and people working from home do fillers, Botox. I know. And it's 50, 80, 100 bucks. And I travel, I'll be in Europe a lot in this summer. When I travel around, you see them. I'm shocked because even when I go to Germany now, Germany used to be, you see people are au naturel. And now I like taking the trains over there. I used to like taking the trains. I don't like it anymore. It's not comfortable for me anymore. It used to be. I used to love it. But now you're waiting for trains and stuff. People are done up because it's cheap. So yes. Okay. Yeah. Yeah. Okay. This is good. Is the forehead area risky or the same as the temple? The temple and the forehead, if I had to label one, the forehead's more risky. But it's close. The reason is your superficial temporal artery comes up and it goes to the temple. Here's the reason the forehead is dangerous. You have your supratrochlear artery, your supraocular artery. Ocular means eye. And the artery, you'd say, well, okay, it's supplying the forehead, great, but you get retrograde flow. So the flow, what I did was remiss to tell you in my lecture was smaller syringes have more plunger pressure. So the bigger syringes, product just oozes out. A small syringe, there's physics, because of physics, that small plunger, the product's coming out of a 1 ml syringe with a lot of force. That force can force the product back through the artery to the branch that leads to the retinal artery, and the retinal artery is what supplies the retina, and that's why you see. So the forehead, so the artery that comes up in the supraocular starts on the bone, and then it becomes superficial. So for injectors, if we're injecting here, which you never really want to do, you want to stay superficial because the artery is at the bone, and up here you want to be deep because the artery goes superficial, and you want to be away from the artery. That makes sense? Watch this again if you need to understand that. But here's the thing that throws it all off, because there's always going to be a but. And this is why you go to doctors, people who study anatomy, whoever your provider is. I know that the arteries connect to the veins in the forehead. It's common to have arteriovenous connections. So that means the artery, high pressure blood flow area to the low pressure blood flow area, they connect. And that means it's easier, even if you get into a vein, it could go back with that high pressure through your arteries in the forehead back to the retinal artery. We don't want arteries communicating with veins, but it happens in the forehead. And again, the right side connects to the left side. In theory, I don't know of any cases like this, you could go double blind. No one wants to lose an eye, but you want to lose two. Not fear-mongering, because this has never happened, but anatomically, when you ask, this is your question, temple versus forehead, which one's more dangerous? Understand, you're in tiger country. That's just the way it is. Start watching this from the beginning. You missed some stuff. This is interesting. Doctor, do you think we should go back to old school? Old school what? Wake up makeup? Wake up no makeup? I mean, just the most important thing is be happy with what you have. I mean, that's the end of the day. Rare things happen. And the problem in society today is that there's a price to pay for doing nothing, because it's a youthful society. I don't want to get off on that bandwagon. You guys can tell me if you want to go down that road, but I know why people come in. Let me tell you a little story that when I was finished medical school, so I was 24 years old. I'm a doctor. I mean, what 24-year-old should be a doctor? Probably none, but that was fairly normal in my day. We're gung-ho. I mean, yeah, we're working 72 hours. We're energetic. That's a good thing. But I'm about 28, 29 and starting 30, 32, starting to inject product. And of course, mainly women coming in, mainly 45, 50. But then we started getting the 25, 28, 29, 32-year-olds coming in, right? Gal comes in. She says, Doc, I said, you're young. I don't see any much wrinkles. She goes, Doc, I'm devastated. I'm old. I said, my God, call me 32 at the time. She's like 27. What had happened? You always got to get to know your patients. We didn't know a lot about aesthetics back then. I'm talking 2004, 5 now. She says, I go to the bar last night. I'm used to just walking straight in. She goes, they put me to the back of the line. That single event, a change in her life that put her back of the bar line, made her go, my God, I'm old. I need to come get lip filler. So that was way back then. Now it's 10x because of influencers and social media. So understand what drives people to the clinics to take these kind of risks. What is the least risky treatment for mid-cheek loss of volume? Well, herein kind of lies the problem, doesn't it? True, I mean, volume cream, yeah, you're going to get some volume. It's good. I use it in between. Do I have a little filler? Little spot here. I was getting rid of that brown spot I've had forever. So there's a little tiny peel. So you see that here. But if you're trying to get volume here, do I have a little bit of filler and sculptor? Of course. So it depends what you're happy with. Are there creams or products that are really going to give you volume in your mid face at 50, 55? Not really. Am I maintaining with volume line? You bet. Am I getting plumping? Because there's vitamin C and different things in there for sure. But am I going to say 50 and 55, 60-year-old, you're going to get it all with the cream? There's no way. If you want your volume restored to 10, 15 years ago. So what's the safest thing? Deep medial fat pad injection with a 24, 22 gauge, 23 gauge micro cannula. It's a relatively safe area, except I showed you that facial artery that comes up. It cannot come close to the nose here. And that artery I've seen many times come through the deep medial fat pad. So, but with a blunt micro cannula, that risk is very low. By far, for blindness and everything, it's the glabella injection, which is common overseas. It's the temple and it's the forehead. But nasolabial folds are dangerous because of that facial artery. This is a great question. Okay, let's go here. I was wondering if you could aspirate before injecting with the fillers to make sure you're not in a vessel. I'm a nurse, 100%. Thank you for being here as a nurse, and thank you for a great question. So aspiration works. Here's the problem. I should have brought a needle down with me. Say this is a needle, and this is the syringe here. In the needle, I go in and the first injection, I pull back on the plunger. I'm going to see a flash of red right here in the hub of the needle. Okay. Now I go inject product and then I move to another spot. Now I got filler here. When I pull the plunger back, I have to pull the plunger to pull the filler back, which can be thick, and then see blood in the hub of the needle. So some people might say, hey, I'm going to inject 0.1 mLs, the syringe is 1 ml, with 10 different needles in the face, because then the needle will be sharper because it dulls when it hits the bone. That's great. But no one's going to go through 10 needles injecting a face each time just to see the blood flashback. And remember, I said the artery can spasm. So it's not always about getting the product in the vessel. It's even if it goes around it, the product can spasm and cause pallor, whiteness, occlusive type of syndrome. Okay. I mean, that's just, I could go on and on about that, but that's one thing that you want to think about. Okay. Old filler in the face. Is that okay? I have not had filler since 2 years. What are you going to do about it? I've got old filler in my face. Is it okay? I watch and see, I posted a while. You go back and watch my videos. I was in Colombia kite surfing and the sand was blowing like crazy. There were those big, long beaches. I didn't think much of it. My eyes were full of sand. I got a sty in my eye, a decent sized sty. Well, 2 days later, I wake up, the filler, which was Voluma. Voluma is a good filler. I like it. Under my eye, my eye was blown up underneath from the filler. So as the infection went away, it got better. But when I got home, there was some superficial. So I dissolved a little bit of it and then it looked good. So is it okay to have old filler in your face? Yeah, sure. There's no evidence it's going to cause you a problem. You probably don't have 20, 30 syringes of filler in your face. It just migrates around, might make you look puffy. There's no data to say that that's a problem. Here's one. Let's see what she said. I heard theories that he died from those male enhancement fillers, if you know what I mean. Correct. I don't know that that's the case, that happened to him. We don't know that. And the sad part is we may never know. I say sad because it would be good for the industry if we knew. We don't even know. It could be a face filler, but that would be so rare. But the male enhancement fillers, certainly we just dissected that at the LAMCA Congress in Los Angeles, Beverly Hills in March. We dissected through the male organ to check everything anatomically. We did an anatomy class. The dorsal vein of the penis is large. It's way larger than I would have thought on dissection and theoretically. But where people go wrong, in my opinion, is in the corpus cavernosum, which are there's 3 areas in the penis that fill and engorge with blood. And people go directly in there because they figure go to the middle, like we go deep in the face. I think that's personally the problem, more so than the dorsal vein, but both are a problem. So there's a safe level. And then a lot of people don't use cannulas. You should use a cannula, but that's becoming more common. Yes. Okay. We'll take this one, not easy gel. So one nice thing about easy gel is, first of all, there's never been a case, knock on something, we don't ever want a case. There's some cases of PRP mixed with filler, but remember, PRP also has lidocaine and different things in it, sodium citrate. Lidocaine is not a pure body product. or PRP is not a pure body product, but PRF is, there's nothing added to the vial. So I've never seen spasm of it, and that makes sense because it's all your own stuff. You don't react to your own stuff. Could the gel part get in a vessel? It could. But if you're going to say, what am I going to dissolve or get rid of more easy than filler or silicone? Certainly it's your own albumin. That's what's heated in Easy Gel. We spin it to heat albumin. And the body's going to break that down. So it'll be, the clot will break down over time. Hyaluronic acid won't break down on its own, and silicone won't break down on its own. PMMA, which is commonly used for buttock, it's dental glue. It's in something called Belafil. I like Belafil, but a lot of people buy PMMA, polymethyl methacrylate, and they inject that because it's cheap. If you watched my buddy Paul Nassif on Botched, there's buttock cases where they're removing it from buttocks, PMMA and silicone. It's nasty, used in that way. Belafil, I like. It's mixed with collagen. I'm assuming that the lip flip surgery may have dangerous risks. I'll maintain my skincare, use your LED and gua sha, plan to save up to get your face masks, volume cream, and hopefully microneedle. That's the safest route. I have something fun coming for you this Saturday, something new. So watch that video. That'll be pretty cool. I'm always stepping up the minimally invasive stuff in your home game. But LED is a lot of the future. I'm putting much more of my, as we see the data, as you guys know, I'm putting much more effort towards LED, home devices. I got back from Korea. I shared a lot of that in my other live stream. So yeah. Let's see what this is saying. It sounds like PRF renamed if it's coming from patient's own blood, right? No, so there's PRF. I have many dentists. Dentists kind of invented PRF, platelet-rich fibrin, to be honest. And then they also make a gel form with a clot that's put in the dental socket for implants and different things. A good dentist friend of mine uses it because she notices decreased infection on anything she does when she puts PRF in there. You can't put a clot in the face or you'll get hemosiderin staining. So what we do is spin it to get the albumin, and we heat the albumin to make a substance, and that's called Easy Gel. There's different forms around the world it can be made. The key is you have to have a studied spinner because you want your growth factors, your exosome stem cells, and that are in your own body, all your natural ones, because you don't have to get exogenous from someone else, exosomes, growth factors. You have them in your blood. Why not concentrate them 6x? That's a great thing. And people ask me, well, what if I'm 80, 70, 60? If you cut yourself in your heel, that's the biggest wonderment of the world in our body, for it to be able to heal itself. You're making cancer cells every day, and your body's gobbling them up so they don't get out of control. That immune system, it's why your sleep, your diet, your appetite, everything's so important. Let's see. Okay, so I've been impressed with new, and I'm just picking comments. I don't know what they are. I'm answering everything. So let's see. I've been impressed with Nua on my neck. Nearly fully eliminated the turkey neck. I've been using it on my arms. Doctor, will it be effective, doctor, on the arms? RF. I've used RF in practice since 2004-5. The first Thermage machines, Thermage came out, we would put IV medication because they hurt so much. Little midazolam. Snowed the patient over with IV for that, if you can imagine. Your Nua is bipolar RF. In 2 weeks, I'm going to have a video for you on something from Korea. But your Nua is bipolar RF. You can use it pretty much anywhere you want. I mean, arms, knee, top of the knees. It's radio frequency heating. Heating denatures your collagen. You get a wound healing response, and the collagen builds back stronger. Are you going to see results in hours? Well, you get the Cinderella effect from the swelling and everything, great. But I mean, real effect with your collagen? No. Are you going to see it over weeks, months, and years? Absolutely. So if you don't want any of these injections and everything, be patient with your skincare. Let's see here. Tesoro combination. Let's see. I'm just here for the, yeah, okay, this is an interesting, not what we're talking about today, but I'm just tardy for this party. Good, like it. You from the UK, tardy for the party, maybe Australia. But I want to ask what you think of Photona laser for face tightening. Does this affect the fat layer? It's just such a common question. And I have a whole video coming from Korea about what I did in clinics there and what we saw. But yes, the fat layer is also important. And here in America, we're not paying attention to it. Understand your own stem cells, whether you're using PRP, of course, I like PRF, whatever you're putting back. Some people are getting fat transfer. That's all to make your own fat better. Great. But Photona laser is, I wish you could come. Maybe I'll do it. If you want to see in Korea from the floor of a show, there's 50 Photona different lasers out there. There's 50 different Cinerons, Candelas, all the different companies that have lasers. Great lasers can be had for 10 grand, even though we pay 250 grand for them in the US. It's not about the laser. It's about heat, level, depth, and setting. So Photon is a great laser company with great lasers. Could you get rid of fat? If you set it properly to get rid of fat, you can. It's like a car. A car can be used for good things and bad things. Let me get some power here, you guys. Let me see. Give me a second. Let me see where my power is coming from. And hopefully we won't run out of power. Let's see. Boom, boom, boom. Okay, we got power. Gosh, so much running here. See, that's what happens without my team. I love my gua sha with Hydroglow, Plasma Glow every day with my skincare routine. Yeah, someone commented on, I read most of your comments under the videos, but someone commented, you can't do gua sha every day. It's too much. I do mine every day. So yeah, gua sha for people that don't know. Let's see what this is. PRF in the wrong hands can't be dissolved, making it dangerous, right? I know you train practitioners of PRF. Is there a database of people that you train? store.rajaniMD.com/locate. So there's people that are in our ecosystem for our skincare. A lot of those people trained with me. But if you're going to get something and you're going to have a novice injector, PRF in the wrong hands is probably better than any filler, any biostimulator, anything else, because it's all your own stuff. Anything you inject can be dangerous. But if I walk in, I put this in my video that you're going to see coming up Saturday, I think. No, the one I'm going to do for next week on the skin tightening and devices. How many of you walk into a clinic, walk into your med spa, and they say, hey, meet the new provider. And they go, by the way, she's going to do your treatment today. There's so many new providers in here. And you go, what? And you're just hoping you're not getting something where the settings can be set wrong, right? Because everyone wants to give you the new provider. It can be devastating. But PRF is one of the things that someone new, I'd rather them do than other devices. PRF is very forgiving. It's all natural. It's all your own. Here's the problem with blood products, what you want to make sure everything's clean. You don't want contamination. I don't like when blood products leave your room. They shouldn't leave your room. Why not spin it right in the same room? The minute your blood leaves the room, there's other people's blood running around. I'm just telling you what I think. Do whatever works for you in your practice. New on the neck, safe for the thyroid area. Pull the thyroid to the side, treat the skin. You don't have to treat over the thyroid. I personally don't mind. Do you like the Didi? Do you like the Voluphi line? Didi can answer that. Oh my God, I didn't know you were doing live. Thank you for my eggs. Let's see, what did you get? You got an Exobomb gift. Oh yeah. Oh, nice. You got your eggs. So we gave away, I don't know how many, we gave away a ton of Exobombs. I don't have them here. I actually used mine this morning. Exobomb is an exosome cream. We have more coming from Korea. For some of you who didn't get it, might be up on the site now. Exogo Bio. It's exosomes plant cell, rose plant stem cell extract. A very advanced cream, and it's used on burns. It's used after chemical peels. It's used to prime the skin. I'm glad you were a winner, and I'm glad you're enjoying it. I'm very stoked to give things away. Okay, this is a good one. This is a good one, you guys. Also, Dr. Johnny, love all your videos. You're so thorough. Thank you. Give me feedback on this live, and for those who are watching late, did I go too deep into the science for you? Obviously, I have all that in my head. This is what I do in real life. And I wasn't sure going into the arterial occlusion, the veins, the pulmonary embolus, if that's too much for these channels, you let me know. Your question is about Alloclay and Renuva. In one of your videos, you were not recommending. What is the reason? So what she's talking about, this is, I don't know if it's a girl, but SNEZ GUR 5507. Thank you. Great question. So there's a ton of cadaver fat products, and then on top of that, extracellular matrix products, ECM products, essentially come from other people. With these products, you're talking about aloe clay was just in New York. Doctors had it confiscated from their offices because New York said, if you're going to have other people's fat injecting in faces, it's purified fat, it's sterilized, they talk about it, but it's still from other people's, from cadavers. It should be tissue banked. That's a special certification you get for your clinics so that you don't mix things up, so everything's in order. So you get tissue bank status. Some people hold other people's fat and stem cells. You just can't hold that unless you have certifications on. This is product that comes in a syringe. It's other people's fat from cadavers that's put in bodies. Here's my thing. The company will tell you, yeah, we check for now. Initially, I don't know how many viruses they check for now. Someone told me, a doctor on a forum the other day, yeah, they're checking for 500 viruses. Great. We don't know. And this is just Rajani talking for me and my face and my family and my patients. That I'm not going to use something from somebody else's fat when I have other products and I have their own fat. The reason is there's something called prions. Jakob Creutzfeldt is a disease of prions. That's the unfolding of proteins in a manner that's uncontrollable. And in Jakob Creutzfeldt, it often causes a neurological problem and death. Not scary, not anything. It's a personal decision. I also wonder, those people that gave up their fat, they gave their bodies for science, but now their fat is in someone else's face or butt running around. No one's been able to tell me where the fat comes from. And do I trust that everything's been tested, viruses and so on? I guess I just have a lot of distrust for all of that. Nothing against the companies, nothing against who's doing it, but with other products off the shelf, do I want other people's fat in me for those reasons? You can fully decide for what you want. I respect everyone's decision. It's a journey, but that's just a couple of the reasons. This is an interesting one. How long after filler injection are you out of the woods? I'm slightly worried because I had cheek filler 5 months ago. My under eye has had a lump under it ever since. Out of the woods for what? I've never seen 5 months later a blindness or an occlusion. In medicine, no doctor that actually practices will ever say never. There's no such thing as never. We don't say it. Anything can happen, but it's never happened that I've seen it before. So it's as sure as you can get. What filler did you say you did not? It depends on the type of filler. PMMA, so Bellafill or calcium filler radius, they're not really dissolvable. If it's a high hyaluronic acid, it's very easy. Just drop a bit of Hylenex in there. Done that all the time. It's no problem. Or you can gua sha, massage it down, no problem. Or you can just leave it if it's not bothering you. Sometimes people get lumps and bumps, they're worried, but if it might be doing good, it might be making you look younger. But if when you articulate and you move, you see it, it bothers you, dissolve a little bit. Thank you. I hate seeing people shame others for enhancements. People have no idea what living in another's shoe is like, especially that shoe drop kicked them in their whole life, no question. And live, let live. Hey, we have a journey, and thank you for saying that. All is well. I 100% agree with you. Where I draw the line is when people harm other people. That's the whole other side of this. And so do no harm, right? And to your point, absolutely correct. We have a journey, and that person took a 1 in a million chance of getting filler and passed away, that we're talking about today. Really, really sad. We never want to hear that. But maybe the flip side of that was bad too. And a lot of people are shamed for their lips, for their eyes, for their nose, for all the things that they have. All as well. There's many ways to interpret what you're talking about, but I thank you for saying that. It's a great point. Mini fluoroscopes. No. Okay. You look amazing. Thank you. You're kind. It's always all about lighting. That's probably what it is. And a decent night's sleep. Not a great night's sleep, but decent. Okay. So, this is interesting. If anything serious should happen, it should happen by now. Why would you get a lump under your eye? Okay. So, if the practitioner's heavy-handed, well, the thing is, if you've done this enough, for one, I think it was cheek filler they talked about. There's a high cheek and a mid cheek. The high cheek, certainly, I've never seen it travel to the anterior cheek. But the mid cheek and the deep medial fat pad, yes, you have an orbital retaining ligament, you have a zygomatic cutaneous ligament, and you have a tear trough ligament. These are ligaments in there. But if you look at, say, the orbital ligament, there's stop gaps in it if you look at the anatomy of that ligament in the face. So the filler can easily, on many people, migrate up. Even though you inject the deep medial fat pad, it can go where you don't want it to. And remember, there's pathways in and around your fat. And even in the fascial compartments, they're not distinct. Although we have them anatomically studied as distinct, they're not distinct compartments. That's just anatomy 101, so it's a great question. Interesting here. I had high few facial fat loss in Japan, 0.3 millimeters to 4.5 millimeters, 300 shots. I'm going to be talking about shots in 10 days in a video. Full cheek and chin. I'm depressed. As I'm only 26 and my under eyes have been totally aged and hollowed. Any suggestions? Absolutely. These are sad cases. I have a video coming a week from Saturday on this kind of stuff. Facial fat loss occurs typically if you're up above 60 degrees, 65 degrees. When I'm trying to get rid of fat, I go to 67 degrees plus for 3 to 6 seconds duration. So it's not just absolute heat. If you want apoptosis or you want to kill the fat cells or necrosis, you want duration of heat matters too. So there's so much goes in this. Some people's fat are going to be more sensitive than others. We need to know that. So it can randomly happen in a small percentage. So there's reasons. What do you do about it? For one, a lot of times it comes back over time. It can take time. It might be short-term depression. Work through this. PRF, platelet-rich fibrin, is what I would use. It has your own growth factor stem cells. It's totally natural. That's the first thing by far to do. Get a face full of PRF. Go to plasmafil.com, F-I-L. I have some cases up there. And great skincare. Decrease sun exposure for a while. A lot of times that fat will come back. Your fat cells will get healthy again. Eat well, creatine, and work out. No excessive cardio. Those are a few things that come to mind. I don't know how long I have to get Sculptor after the first time. How long do you wait after getting one session? First time, maybe 6 to 8 weeks. If you have the fullness you want and it keeps building, there's no rush. Wait 3 to 6 months before your next one. I'm a huge fan of the NUA. NUA works. It's amazing. The NUA Home, for those who don't know, the NUA RF, I like it too. Thank you. I think it's an amazing device. Oh, here's one. I had a vascular occlusion 9 years ago in the cheek area. Thankfully, I had no major damage, but some volume loss. Will I ever be able to have filler in the same area, or is that vessel damage? Great question. I don't know your whole case, obviously, but here's a generalized answer. 9 years ago in the cheek area, there's much more to that. For one, if you liked your doctor and he or she is good, you go back, because was a needle used? How much filler? Where exactly was it? You can ultrasound it, but is the vessel damaged? No. Could there be some collateral vessels around it? Sure. Does that mean it'll happen again? No. Would you get a little bit of filler? Yes. Would you use a large? If I'm the doctor, I'm not worried. I'm going to do it again in that area. If someone came into me with your story, for sure, I would do it. I would use a large gauge cannula. I would anatomically go in the safest of zones. I would go small, and I would really like to know what product you had before, because I'd probably switch it up in case it was spasm due to the product or reaction to that product. So if you had Restylane, I might try Juvederm type of product. There's many on the market in the US now. You have RHA, you have Reviness Versa. Doctor, what is ZERF and what are the benefits? Okay, ZERF is a monopolar radio frequency. The problem with ZERF is it's got 6.78 megahertz and 2 megahertz. And the 2 megahertz goes deeper. Unlike the nanometers of your red light mask, where 800 nanometers of light goes deeper than 600, it's the opposite with radio frequency. So your 2 megahertz in your ZERF goes deeper than your 6.78. That deeper, this is just me. I just got back from Korea. Zerf, by the way, in Korea, it's called Zerif. This X is Zerif. So I went over there, said, let's do some Zerf. Let's test Zerf. They said, we don't know what Zerf is. Zerf. I spelled out, oh, Zerif. So we tested it. And I looked at the power ranges. Now, one I like called Extherma. Why? Extherma is monopolar RF, but it doesn't have that deeper wavelength in it. It has the most power. It has 400 watts of power. It's something called Extherma. By the way, XTHERMA, it's in the US now. There's 250 devices, something like that. But we heat mapped it. It stays superficial, so it doesn't go to the fat layer. So you get the most power in the skin. That's skin tightening. Try not to mess with your fat. But Zerf is like monopolar RF is Thermage. Zerf, there's a ton of them around. An old one, I'm trying to think of the name of an old one we used to have. It's blue, it's a 5 letters in it. I'm not going to think of it. But those are, you guys will know Thermage. Density, you might not know Density, that's newer here. But Extherma, in my opinion, is the one to look for. And it also cools at 4 tips, or senses temperature, sorry. It does cool. It's comfortable. You don't need topical. I've had pulses. But on the corner, on the tip, it has temperature senses. So it's always sensing the temperature of your skin for feedback. The other thing it has that no other device that I know has is it gives you the exact amount of joules put into the skin with each hit, and it measures the total joules you've had over your whole face. So it's Extherma, it's next level. I like it. Okay, can I do face massage if I've had fillers? Yes, not deep face massage. Do you recommend microcurrent devices? Yes, I like microcurrent. Great. Let's see. Anything else you guys want to talk about here? You love the sign. Okay, you love the signs. Thank you. I'm glad we didn't go too deep on that. Cadaver. Did you ask something about cadaver fat? Please continue. It's truly appreciated. Yeah, knowledge is power. I agree with that too. Estriol for face. Yes. Here, a lot of people like to hear 70. Let me just see. What did you say? 75 years old. We need to hear from you. Experience. And I've been using your gua sha. Can I expect improvement in lift? I don't have unreasonable expectations. Just wonder if my skin will look a little bit lifted. I find gua sha lifts, but here's understand how you're using mine. So you have red light and vibration. I put red light in there, 630 and 830 nanometers. There's vibration because I like the data of bone and vibration. So will you expect lift? At 78, no two 78-year-olds look the same, and expectations aren't the same, but you get increased blood flow, you get red light, and you get vibration. Those are 3 things. If you're into natural, for me, I want for my clients' faces. At 78, it's going to take more. If you want to be, I'm just taking rough numbers, you want to be 78 and look 65, you're probably going to need more than gua sha. But your expectations might not be that. Are you seeing improvement? You should for sure. Because all those things, increased blood flow, red light, the vibration, gua sha itself, used for centuries. And people are happy with gua sha. So why not? Yes. But again, everyone's different. I can't guarantee what you get, but it's part of a skincare routine, 100%. I love it more and more. And I'll tell you, I have a lot of practitioners who I lecture with and travel, and they have it. You see them, they brought it to Korea. They take it with them to the Vegas conferences. They take it with them on vacation. Why would you take gua sha? Because it gives, for me and many of you, gives you that pickup just before dinner. Gua sha your face, the lymphatic drainage. So it's amazing, yes, but it's part of a routine. Canada, let's hear from you. It's Canada Day today, by the way. If you didn't know, it's July 1st. It's Canada Day. I'm from Canada. My med spa wants me to do a session of IPL right before the CO2 laser on the same day. Is this something I can do? Does IPL melt facial fat? So your medical provider, I don't know who they are or what they do, but would I do it? I would 100% do it. IPL is different. It's broad band of light that's filtered into specific wavelengths. So for you might do 580s if you're trying to get reds. If you're getting browns, you go higher. You adjust the wavelength of light. It's way more high powered than LED light. So it's powerful and it can burn you, but at the right settings, it's broad-based light to target, in your case, browns, I'm sure, maybe some reds, and then you go to CO2. CO2 is 10,600. It's attracted to water, totally different treatment. I would stack them on the same day, no problem, but CO2 is not CO2. I have CO2 sitting right here. I can make that cut like a surgical cut. I can make CO2. I can make all the surface area within my spot size treat 100%. I can make only 50%, 30%. I can go deep. I can go superficial or both. So it's all about the settings. You need an expert. You definitely need an expert. Yeah, many of you don't want cadaver fat. I see that. I'm just going to grow old gracefully. Yeah, this isn't to scare you. It's to educate you. My aunt had temporal brow lift. Now her right brow will not go up. It's been 6 months. Had EMG test and the nerve was detected. So what will happen to her in the long run? I don't know. I'd have to review the EMG test, but I will tell you, with the advent of deep plane facelifts has been around for a long time. Anyone who's doing facelifts is doing a combination of either a deep plane facelift combined with a superficial SMAS lift, and there's all kinds of combinations. Everyone has their own name for it. But suffice it to say, as people go more and more deep plane, and as you do more, and as you do younger and younger people, the side effects come through, and nerve transection is one of those. Most commonly, you ding the nerve and the nerve comes back. That's what happens. I've seen cases where you go back in, you got to release the nerve because the nerve was under tension. I'm not telling you about your case. I'm just telling you about cases I know. But there are young people, meaning 40 and 50, who've had facelifts, who the nerve was transected. There's a protocol to get them back. But will they always have some type of droop or deficiency on that side of the face? Will it likely get worse as you age, like always happens because the face fat droops as we age? Yes. A deep plane facelift has a lot of dangers. How long is Exobalm good for? Great question. The beautiful thing about Exobalm, it has lyophilized, just like in your Botox, Dysport, or Xeomin, lyophilized, so freeze-dried stem cells. When you're ready, you mix it in. So it'll last you a year or two, lyophilized, just like Botox does. These are stem cell exosomes from plants. You mix it into your cream. You know, the instructions are there. Put it in your fridge. It'll last at least 3 months, probably 6 months, but we know it lasts 3 months. But it's 15 mLs, I think it is. I'm using it. I used it this morning on that spot that I treated here. I want it to heal quicker. I want to hit the water. And so you're going to use that in a month to 3. That's how long it lasts. It's not a ton of product, but it'll last you 3 months. That's your answer. Okay, can I say something about RHA? I may have missed a video on it as an alternative to Restylane. Sorry for spelling. Yeah, RHA is a good group of fillers. I like them. I think they stole my Baby Glow. They got a sign. I'm kind of joking here, but they got a sign Baby Glow with their RHA1 product. There's 3 different ones. There's 4, but one is their lighter one. They're calling it kind of their Baby Glow one. It's a good filler. IPL was done on a reddish brown scar after cat nail stuck into my eye. IPL made it bigger. Sure. That's an unlikely thing, but you may have had a burn from it. You may have had too much energy was put into it. Nice thing with something like that, it's superficial. You could just get a tad of filler put in. You could microneedle it. But, you know, for a little pock scar or a little defined scar, because a nail stuck into something, I have a couple where I got hit with a hockey puck, had a hematoma, had to put a drain. I did it all myself, put a drain in my face. And I got like a little, what you're talking about here. I just put a little bit of superficial filler, maybe every 4 or 5 years. It's a scar, but it's depressed. And because I put it superficial, the risks are very low and it doesn't metabolize away quick or migrate because it's superficial. So a tiny bit of filler, that could be an amazing way to deal with that. And I know it's near your eye, but honestly, the vessels around the eye out here, it's one of the safer zones, although it's around the eye. If you know your anatomy, it can be safer, even though it's close in proximity to the eye. Dr. Yes, girl and from Australia. Okay, now we know Australia. The way you even wrote, I could tell you're probably Australian. What face tightening do you recommend that has the least probability of melting the fat layer? By far, Xtherma. XTHERMA. If you're doing a home device, NUA has a built-in shut-off at 42 to 43 degrees Celsius. Xtherma, you're going to get higher end results. It's done in clinic. That's 40 to 60 degrees C. RF microneedling that I use to get rid of fat, an RF microneedling device, I go to 67 to 74 degrees for 6 seconds duration. But with Xtherma, you're going to get shots. Boom, 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 shots. About 3, 400 shots will do your face, 300, 200 to 300 do your 200 will do your neck. So 600 shots face and neck. That's the one that you want to look for. Lisa's commenting. Many of you are on it, right? The NUA is amazing. Thank you for commenting, Lisa. Let's see. Thanks so much for all the information. It's priceless. Also good for anyone who wants procedures. Any procedures done. I do not believe in shaming. That is wrong. They are probably jealous. Have a good PM, everyone. Yeah. Of course, we all have a journey, and it's very specific. We don't know what reasons people get it for. You got the NUA from me. Good, awesome. Can the NUA help underarm fat? No, it's not. Fat sag. Yeah, but if you have a lot of loose skin, if you're pinching inches, that's a surgical. But it can tighten skin, but it's not. If you have an inch, 2, 3 of skin, surgery is probably the only thing to get rid of underarm bra fat. Are you bringing new? Yes. Here's an interesting. Are you bringing new devices, skincare? Yes. This Saturday. I'm hoping everything goes the way it should, and I think it should. I'll have something new for you in skincare. So watch that video. It'll be Saturday morning at 8 a.m. The more we do, the more that you guys are on here, the more you like these lives, the more that's purchased on my store, the bigger I grow, the more I'm giving away. You already see people on here who've won stuff. Someone had an exobomb. We gave away LED masks. We give away NUAs. We give away all kinds of stuff. To my ideas, we have a group of great people. You see the knowledge I presented today. You know, I've done this over 25 years. I work with the best of the best in the world, all around the world. I'm happy to bring that to you. So the bigger we grow, the better it is for all of us. So we did a lot today. That's that case. Super sad. Go back. If you're just joining this, go back. We have our next live is coming up. It's a Sunday. It's June 12th, the Sunday. You guys, I don't know my days anymore. July 12th. July 12th is a Sunday. We're going to have a live on July 12th, probably like 10 a.m. I don't know. Oh, where are we here? Oh, you got me. Okay, great. So we'll do that live. And I think we're going to talk some skin tightening on that and new skincare on that too. But this Saturday, I'd appreciate if you watch that video. You're going to want to see it. It's pretty cool stuff. It's from Korea. And keep following, keep letting me know. And we'll see you on that live. Thanks everyone for being here. Keep the comments going. The more you tell me what you want, the more I'll do. Have an amazing day.